A quick video about an 87-year-old complex patient who has recently been seen by cardiology about 3 weeks ago. Atrial flutter slash fibrillation. He's under investigation. He's got a 24-hour cardiac monitoring coming up in about 2 weeks' time. He was started on bisoprolol 1.25 milligram once a day, which he has been taking. And he called back last week, spoke to one of our colleagues, and was complaining of still feeling palpitations every now and then, and feeling tired and lethargic and kind of occasionally dizzy. So colleagues decided to advise him to increase bisoprolol from 1.25 to 2.5 milligram once a day, which he started taking since last week, and he feels that his symptoms are worse. He's more sleepy, he's more dizzy, he's not able to do as much, more breathless, reduced exercise tolerance, all those other things. This guy is quite a complex patient. He's an ex-smoker for 30 odd years. He's got lungs disease, probably exposure to asbestosis, I think, and he's got some sort of fibrotic lung disease. Quite a complex guy, so I think his breathlessness and other symptoms of reduced exercise tolerance are not purely because of his heart problems, but also due to his lung problems. So he came in, was quite upset, wife's quite upset, so very important to relax the patient, try and really understand what their concerns are before you start throwing solutions, because if you don't know what their main concerns are, it's very difficult to then try and find solutions. You may find a perfect solution that's not perfect for that patient. So very, very important to listen. So I did. Anyway, the plan is now, after speaking to them, that to reduce bisoprolol back to 1.25 milligram as originally decided by the cardiologist, and they are going to see a cardiologist in about 2 weeks' time, and I've advised them to discuss that with the cardiology team rather than one of us trying to tweak the meds. I've also requested bloods just to make sure all of his full blood count, etc., USANEs and CRP is fine. There's no chest infection cooking. I did listen to his lungs. They were, normal, really, air entry throughout. There wasn't anything too concerning. And I've also requested a chest x-ray for him, just to make sure if there is any advance in his lung disease, because his last chest x-ray was in 2021 and he's going to see a cardiologist. So I then discussed this plan with one of my colleagues, and they agree with this plan being very reasonable. I just thought I'm sharing these thoughts purely because it's making me think about how I think or how I need to think. So it's covering my blind spots, sharing my thoughts, sharing my learnings as we go along. It's going to be a long journey. As we know, I'm starting again, going back to med school, going to be learning all of this all over again, and hopefully in much more detail. I hope to be a much better, much more competent clinician towards the end of these 5 to 10 years. But more importantly, it's given me something to do. It's given me a goal. It's given me this clear path where I can continue to learn and get better over the years. Ciao.